happening tonight in Vancouver.
And yelling at healthcare workers serves no purpose at all.
The province looking at what protections are possible with more anti-vaccine protests planned at BC hospitals.
It's not as pleasant an environment to work in anymore.
The cost of treating a critically ill COVID-19 patient. We are getting a sense of the jaw-dropping numbers even as doctors report severe staff burnout.
If last night was any sort of guide for us today, Justin Trudeau does have the wind in his sails.
Federal leaders prepare to go again in tonight's English language debate.
This is City News Everywhere.
No vaccine passport! No vaccine passport!
Protesters who mobbed hospitals over vaccinations and BC's vaccination pass are planning to do it again.
It continues to be enormously frustrating, demoralizing, and quite frankly, insulting to healthcare workers that these protests are taking place in front of healthcare facilities.
Provincial leaders clear there's a place for protest, and this isn't it.
And yelling at healthcare workers serves no purpose at all.
Not saying if this will include applying for an injunction or creating a bubble zone around hospitals on the target list for Monday, but it's clear protections will be in place.
Our priority is to ensure that patients are kept well and are not in any way intimidated, and to ensure that our healthcare workers are kept safe.
The city of Vancouver, where the crowd made an ambulance driver struggle to get through near Vancouver General Hospital and held up cancer patients going to treatment, offering help and some advice.
My message, though, would be don't do this. Don't risk people's lives for the sake of making a political point.
As for people thinking they're heroes by choosing not to be vaccinated,
nothing heroic in presenting a target for COVID-19. There is nothing altruistic in attracting its infectious aim. There is nothing gained by anyone when someone falls victim to its vicious hold.
Of the 130 people in intensive care right now, 111 have not been vaccinated, 93% not fully vaccinated. More than half of those are younger than 50 years old. The irony of where these anti-vaccine, anti-mask, and anti-vax pass protesters are targeting, not lost on health professionals.
And some of them are going to need care. Some of them are going to need to be in hospital. Some of them are going to need oxygen, and some of them will end up in the intensive care unit.
For City News in Victoria, I'm News 1130's Lisa Yusta.
It's not as pleasant an environment to work in anymore.
Heart attacks or COVID-19? Which do you think places a greater demand on a hospital's ICU in terms of cost and resources? A new study is focusing on just how much COVID-19 is costing our healthcare system as the virus has ICU units across BC reaching their limits, and doctors report severe staff burnout on the front lines. The Canadian Institute for Health Information says costs could climb to about $50,000 for a COVID-19 patient in ICU, compared to $8,400 for someone who had a heart attack.
And not like a typical heart attack patient, where things are usually made up one way or the other in less than a week.
The report covers data between January 2020 to March 2021.
That piqued my interest.
Meanwhile, Dr. Gerald DeRosa of Royal Columbian Hospital says the ICUs at Abbotsford, Surrey, and RCH are on their way to hitting capacity as more staff is being pulled in to help those units cope. Others are being forced to bear the brunt.
The worse it gets, the more stress it's going to put on the system, the more it's going to decrease other medical activities. And I think the concern that I have mainly is the more stress it's going to place on the system and the people providing the care. You know, we've been fighting COVID now for more than a year and a half.
DeRosa says that has workers moving away from frontline positions, some even retiring early.
Do overtime shifts and then just getting tired, and then the lack of vacations and travel and everything. And, I think that also has a role to play. There are easier jobs to do than work in an acute care hospital.
In places like the interior, we're seeing hundreds of surgeries being canceled or delayed. And even though we call these surgeries non-urgent or non-emergency, they're anything but not important. These are still important surgeries. These are often cancer patients, for example, that are seeing their treatment delayed because of this. And our healthcare workers, after 18 months, don't have much more gas left in the tank.
The province reported Thursday out of 130 patients in ICU, 111 are unvaccinated. And doctors say that's obvious at the hospital.
You look in someone's face and you know, they're getting sick or they need to get intubated, and you know, you hear them say, I just wish I would have listened and got vaccinated, or their family members are saying, you know, it's just heartbreaking to see.
In Vancouver, Crystal Adaris, City News. Meanwhile, BC is recording 774 new COVID-19 cases since yesterday, with 5 more deaths being reported. More people in hospital with the virus today, 262 patients in total. Out of those, 130 are in the ICU. And as we mentioned before, 111 of those critically ill patients are unvaccinated. Vaccination numbers don't seem to have changed much over the last few days. More than 85% of eligible people in BC have received 1 shot, and over 77% are fully vaccinated. It's the first few days of classes for students at schools across BC, and post-secondary is no exception. While many of the students at Simon Fraser University have been receiving their education remotely for the past 18 months, there are some concerns that not enough is being done to ensure students and staff are being protected as they come back to campus. Gabe Loisis is the president of the Simon Fraser Student Society. He says more needs to be done to ensure that students aren't put at an unnecessary risk.
Students, faculty, staff members are required to self-disclose their vaccination status. They don't need to show any proof of that self-disclosure. But, you know, we see that there needs to be a vaccine mandate in place for students to feel safe. I mean, when we're talking about students sitting in a lecture hall with 200, 300 people, and the thought of sitting shoulder to shoulder with someone who you don't know their vaccination status, that's really unsettling for a lot of students.
At this point, proof of vaccination is needed for on-campus activities like attending student club events, on-campus dining, and going to the gym. This goes into effect September 13th. Advance polls open tomorrow, and millions of Canadians will be able to cast their votes at polling stations across the country. Advance voters will have until September 13th to cast their ballots ahead of Election Day on September 20th. With our country in its 4th wave of the COVID-19 pandemic, Elections Canada says staff and voters are expected to follow all health protocols. Poll workers will be behind plexiglass, wearing face masks and shields, and sanitation stations are being made available. Physical distancing will also be enforced. Voters are being reminded to bring in their voter information cards and identification.
Justin Trudeau is a seasoned politician. He knows what he's doing. People have always underestimated him. And I don't think the opposition party should never, ever do that.
While there wasn't a clear winner at last night's French language debate, political scientists say the Liberal Party leader showed why he's not to be underestimated. Party leaders are getting ready to go again for tonight, the only English language debate of this campaign.
This is the period before an election when people start to make up their minds. When voters look at party platforms, or at least look at headlines in newspapers, and start to think about who they're going to vote for. So I think in that way, the English language debate tonight will be crucial.
Keith Brownsey at Mount Royal University says tonight's English debate will have lots riding on it, and that the battleground in this election will most likely be Ontario, which sends 121 MPs to Parliament, and where Conservatives hope to make headway in suburban ridings. However, Aaron O'Toole is now leading in the polls, making him an attractive target for other leaders.
I think Aaron O'Toole is very vulnerable tonight. His party's come out and they've said that they would make massive cuts to daycare. They would savage the CDC, probably privatize it. I mean, there's issue after issue there that isn't on the side of the Angels, or in our case, the side of the majority of Canadian public opinion.
Well, François Legault did today say that he has questions, that Aaron O'Toole needs to answer questions about daycare. but he said on a host of other issues, including healthcare funding, which is very important, that the vision of federalism of Erin O'Toole and the Conservatives is much more consistent to his vision of federalism.
However, the Conservative leader has just won a coup more valuable than both French-language debates, the implicit endorsement of Quebec Premier François Legault. Legault on Thursday morning distanced himself from Justin Trudeau and gave a tentative thumbs up to Erin O'Toole. Legault remains popular in Quebec, and his words will have a role in how Francophone Quebecers see the race.
For Quebec nationalists, basically the message is that it's better to have a minority conservative government than a liberal minority government. And so it's not an endorsement of the Tories, but it's certainly a message to Francophone voters in Quebec that the Conservatives are really a better choice.
The English language debate happens here at the Canadian Museum of History tonight at 9 p.m. Eastern Time. City News will have highlights for you tonight on our late show. In Gatineau, Xiaoli Li, City News.
Transit police are asking for the public's help in identifying a man who approached several women on the SkyTrain and allegedly exposed himself to a female passenger on August 3rd. The woman says the man was sitting across from her despite a nearly empty train and masturbating. The suspect is described as a Caucasian man in his 20s with dark blonde, light brown hair, light stubble, and a slender build. He was wearing a light brown t-shirt, shorts, and carrying a blue backpack and a longboard. Transit police believe he may have targeted others, and anyone with information is asked to contact Metro Vancouver Transit Police. Some scary moments after there was a fire at the Terry Fox Secondary in Port Coquitlam earlier today. The Coquitlam School Board says it doesn't appear to be suspicious, and thankfully nobody was hurt. It says the fire was electrical in nature. It's still not clear if anyone was in the classroom at the time it sparked. That wing of the building remained closed through the day as crews tried to assess damage. Police in Coquitlam aren't saying much about a body that was found following a house fire last night. RCMP says the body was discovered around 9 p.m. at the home on McTavish Court near Hockaday Park. No further information is being released at this time, including the identity of the deceased or the possible cause of the fire.
And at this point in time, no identification has been made. To our knowledge, it will be likely days before we can get inside the residence due to safety of the structure. Police are investigating an arson, and at this time have deemed there's no risk to public safety.
The BC government wants your input on plans to shape and update the province's anti-racism data legislation. The Attorney General's ministry says public engagement will run online until November 30th, and it will be used to inform the government about how to collect data in a way that reflects the needs and experiences of those who are Indigenous, Black, and people of color. The province says the public feedback will help better identify systemic racism in existing government programs.
Many people of color have different experiences in terms of how they are impacted with government. We want to take those experiences and translate into policy and legislation. And by knowing these gaps, we can improve access and deliver more culturally safe and appropriate testing, treatment, and prevention strategies.
Singh says systemic racism has led to the mistrust in government programs by marginalized groups, and that she also plans to meet with various groups for more targeted information later this fall, including those who have experienced discrimination for reasons other than color, such as gender, sexual orientation, faith, or ability. This month's Coyote cull has seen 3 more animals removed from Stanley Park, bringing the total number killed to 4. Ministry of Forest staff say more wild animals will be trapped and euthanized over the next couple of weeks. That's when a reassessment will be done to determine if there's still a risk to humans visiting Stanley Park. The ministry says relocation is not an option as the coyotes are food conditioned and aggressive. In recent months, coyotes have bitten at least 45 people, including 5 children. Nearly 100 firefighters from Mexico begin heading home this weekend after battling wildfires in BC since late July. The team and several support staff responded to our province's call for help as hundreds of wildfires flared. More than 200 wildfires are still burning in BC, but no new ones have been sparked in the last 2 days. And the number of homes under evacuation has fallen to 243 from over 6,500. And just before we go, some breaking news from the sports world. Canada's Leylah Fernandez has just clinched a spot in the U.S. Open final with a win over Aryna Sabalenka of Belarus. The 19-year-old from Laval, Quebec, beat out the number 2 seed on Thursday to advance to Saturday's final. We'll have all the highlights on our next edition of City News at 11 o'clock. Thanks for watching and have a great night.